Hi, I'm Dr. Dwayne Carlson with Community Hospitals Western Orthopedics and Sports Medicine. I'm an orthopedic surgeon here to talk with you about improving the likelihood of achieving your goal of successful spine surgery. Your spine surgeons, Drs. Shorten and Clifford, have protocols and have researched the best methods of improving your likelihood of successful spine surgery from the surgical standpoint. Protocols are in place for decreasing your risk for complications. Our discussion now will not focus on the actual surgery, but your readiness for it. Dr. Michael Englesby, a transplant surgeon from University of Michigan, states, "The best analogy to a 2-hour operation is about as hard on your body as running a 5-kilometer race as fast as you can go. If you were going to do a 5K, you would want to train for it. It also makes sense that our patients should train for surgery. If you're supposed to be training for surgery, so your body does what it should, what should you be doing to train to optimize your results?" Before we get into that, we need to talk about what happens to the body when anyone has surgery and how different medical conditions alter possible results. Many of the things that happen before and during your surgery increase the inflammation in your body. Scientifically, we call this inflammation oxidative stress or redox imbalance. For our purposes here, we will refer to it merely as inflammation, but if you want to research it at home, refer to it as oxidative stress. Inflammation results from a number of different sources. Many of the anesthesia medicines increase that inflammation. The surgery itself is the most inflammation producing, which unfortunately can't be eliminated. What is the problem with inflammation? If the inflammation during and around the time of surgery increases too much, your likelihood for infection, wound healing problems, stiffness, blood clots in your legs, heart attack or stroke, increasing pain, stiffness, non-healing fusions, and many other issues increase. The key is to limit the level of inflammation in the body, keeping normal physiologic functions in balance. Generally speaking, young, healthy patients are least likely to have complications with surgery and pain. However, not all patients are young and healthy, so our baseline inflammation is increased. Unfortunately, as we age, we accumulate inflammation, even if we've lived fairly healthy lives and don't take medications. Some patients also have pre-existing conditions such as diabetes, high blood pressure, heart disease, kidney disease, or are overweight. Each of those medical conditions are symptoms of an already high inflammatory state, adding to the inflammation of age. I look at inflammation as a sink that has a faucet and a drain. The water coming in from the faucet is increasing inflammation, and the drain is your way of draining the sink or decreasing inflammation. Lifestyle choices either fill or empty the sink. Things like adequate sleep, hydration level, baseline stress, exercise, diet, and a number of other factors affect the body's inflammation or the sink's level of filling/inflammation. When you undergo surgery, there is a sudden surge in the inflow of your inflammation. If your sink is relatively empty, you will tolerate the inflammation increase. On the other hand, if your sink is already nearly full, you are much more likely to have your sink fill and pour over, resulting in the likelihood of a complication of surgery, infection, wound healing problems, or otherwise. The question is, how does one open the drain and decrease the inflammation or the sink level? The antidote for inflammation is antioxidants and those lifestyle choices that maintain the antioxidants in the body. That seems pretty easy. Just go and buy some antioxidant supplements and that should drain the sink, right? Unfortunately, I don't recommend that course of action. Antioxidant supplements and vitamins are not helpful with your body's antioxidant sink and may actually fill it rather than empty it. There are a number of studies showing antioxidant supplements not only don't help you, but actually may hurt you. The National Institute of Health states that there were no proven benefits of taking antioxidant supplements and vitamins. When we take supplements, we get only one or a handful of vitamins or antioxidants. When you eat the whole plant food, say an apple, you get many different antioxidants, all in the right concentrations along with the fiber. It has been shown the antioxidants work together, and when in the right concentrations, decrease inflammation better than supplements do. There is a high likelihood that fiber also works together with the antioxidants. Thus, don't use supplements to drain your sink. There are a group of lifestyle behaviors termed the antioxidant lifestyle, which will help your inflammation sink. These include exercise, whole plant food diet, hydration, good sleep quality and duration, sunshine to make vitamin D, stress modification, close loving relationships, avoiding smoking and alcohol, and avoiding toxins and heavy metal exposure, most commonly seen in fish and meat. That's a long list of things to do. Your healthcare team will provide this list to you prior to surgery, along with a plan to put these behaviors into practice prior to surgery. For now, let's talk a little deeper about several areas that many people struggle with, which can make a big difference for you. First thing is food. As I mentioned before, whole plant foods have been shown to be the most anti-inflammatory. These whole foods include fruits, veggies, whole grains, not processed, whole grains, legumes like beans, lentils, chickpeas, and the like, nuts and seeds, and herbs and spices. Avoid processed foods as the antioxidants and fiber are removed. Cut down or avoid animal products as they increase inflammation as the processed foods do. Exercise. Studies show that patients who exercise before surgery have a better recovery with fewer medical complications and other problems. Sometimes it's hard to exercise due to the pain that you want to eliminate with the surgery. Find something that will improve your fitness, whether that is walking, swimming, stationary biking, or something to increase your heart rate. Ideally, strengthening the back muscles using a very mild core strengthening program will help, as your back muscles will get weaker due to disuse during your postoperative course. As will be said in your handout, perform exercises that is at most moderate in intensity for your current level of fitness. Overdoing exercise can also increase your inflammation. Stress modification. Surgery can be stressful, both during your operation and postoperatively. Well, like not working for a while with no income, how do I care for my animals, and many other work or family-related concerns. We recommend planning for these prior to surgery to reduce your stress, such as having someone available to help you care for your pets or children. Worrying about surgery is natural, and you aren't alone. However, worrying can increase your inflammation levels. Trust the surgeon and his team to provide you with the best care possible. If you have other questions or would like to talk with someone very interested in the benefits of lifestyle modifications to reverse disease, please make an appointment to see me, Dwayne Carlson, through Western Orthopedics and Sports Medicine. Please be sure to let the scheduler know that you are a lifestyle medicine patient to ensure we have time necessary to discuss your needs. There are a few medical conditions we will provide more information about after this video, including type 2 diabetes, hypertension, heart disease, and COPD. If you have an interest in further study or different topics, please visit the website nutritionfacts.org for evidence-based nutritional advice. The recommendations provided on that website are based on scientifically proven studies and not on expert opinion. I hope you find these recommendations helpful and wish you a very successful surgery. Thanks for choosing Community Hospital for your healthcare needs. We're honored to be your medical home.